Great. So welcome to the first Laundry Talk session of this afternoon. Today we'll be talking a lot to do with the healthcare laundry sector. Now earlier you did hear from two doctors about their perspective and their perception about how they handle the clean linen laundry in the healthcare facility. But today we're talking to the end user, the service providers and the equipment providers and the chemical providers on their take on the healthcare laundry sector. Now, last year we saw a lot of changes and innovations and opportunities for the healthcare laundry sector. So in this discussion, the experts will address the changes that they have embraced, the practices that they will implement to build the continued trust with their healthcare customers. So before I hand over the discussion to the moderator, I would like to introduce all of you to the panel. We have here with us Mr. George Damasceno, the CEO of Bubble Laundry, who brings with him a wealth of experience. Now, in 2019, Bubble Laundry, in fact, won one of the biggest healthcare contracts in the UAE worth close to 50 million dirhams for 5 years. Now, Bubble Laundry caters to 8 public hospitals in the Abu Dhabi region, and not to forget, at the same time, servicing 45 of their already existing healthcare clients in the UAE. Also joining this panel is Mr. Owen Flavin, the industry advisor and partner and head of innovation practice of Stepstone Consulting. Now, from providing business strategy, management systems, accreditation to advisory services, Mr. Owen also is a biocontamination control specialist. We also have with us Mr. Abdul Rao JJ, the Master of Professional Textile Care and Technical Territorial Consultant and the representative in the Middle East for Seeds Chemical. Now, with more than 19 years of experience, Mr. Abdul Rao comes with a strong background in dry cleaning, chemicals, and textile machinery. Joining the panel is also Mr. Tim Bacon, the Director of Alliance Laundry Systems, Middle East, Africa, and India. And Mr. Tim has spent the last 16 years in the equipment and hygiene fields. And for the last 6 years, Mr. Tim has been the Director for the Greater Middle East and Africa and India region for Alliance Laundry. Now, his responsibility extends over 74 countries across all of their brands. And lastly, and not the least, our moderator this session, Mr. Gregory Geisbrecht. I hope I got that right.
Very good, very good.
Yeah, thank you. The president at Sterile Surgical Systems and past president at Healthcare Laundry Accreditation Council. Now, Mr. Gregory is a distinguished in the reusable textile industry as an advocate for increasing awareness of the significant role that having high standards in the processing of healthcare laundry plays in broader infection prevention strategy. He is the president and CEO of Sterile Surgical Systems, which is a fully service accredited healthcare laundry and reusable sterile surgical textile pack manufacturer in Washington, USA. He is also the past president of HLAC and currently serves as the HLAC Inspection Committee Chair and led a committee that developed the HLAC Laundry Processing Monitoring Toolkit. So thank you so much to all of you for taking time out for us today. And I'm really looking forward to an interesting discussion from all of you. So over to you, Mr. Gregory.
Okay, thank you very much, Megha, and thank you, Fatima. We appreciate being able to participate in this forum virtually during these times. We've certainly learned some new things about how to network, and we're looking forward to a great session here. Thank you to the other speakers on here. I think we have a good, diverse group of experts from different parts of the industry, and hopefully we can share a lot of knowledge. And please feel free, if you have questions, to ask in the chat, and we'll try to get to them. We do have some topics that we want to discuss initially that we think cover a lot of the current issues happening in the healthcare laundry space today. So what I'm going to do for the format of this is I'm going to pose a question, and then we'll just go around with Owen, Tim, George, and Abdul Rauf, and then I will throw in my 2 cents as well. And as I said, I think we have a pretty good, diverse group of backgrounds that can attack the questions from different areas and hopefully be very informative for you. So the first question, I'll start with Owen. And what does healthcare laundry look like in this new post-pandemic world that we live in? And just to dig in further, what are some of the changes that you've seen being embraced by laundries during the pandemic?
Well, I love the sound of a post-pandemic world. That has really got a ring to it. I'm not sure we're there yet, and I know we're not wise enough to say we know what it looks like, but we can try, and and that's the essence of planning. Every plan fails the first contact with the enemy, but if you've got no plan, you are completely up the swanny. So I'd like to think that healthcare post-pandemic is the same and different. I think that healthcare laundry, as opposed to some of the other sectors, certainly in the countries that I work most, was less impacted and more prepared. And in most sectors where there's any degree of development in terms of facilities and standards, the healthcare laundry standards that were there served to make sure that the healthcare laundries could continue to serve their hospital customers and the patients and professionals who needed it well. I have not heard bad stories. I have heard that country after country, provider after provider, did everything, did their utmost 24/7 and made it happen. We've also seen some opportunities to expand where what is an isolation gown? Does it have to be a single-use product? What about masks? What about scrub suits? So there are opportunities for growth as well. And then we can talk about new scenarios in the future where we can really grow or change our thinking about what healthcare laundry can do. But I think for healthcare laundry, broadly, it was a difficult, challenging, but I think there's quite a lot of validation in that. What we were doing wasn't half bad.
Excellent. Yeah, I think that's right on with what we've observed in the United States Pacific Northwest as well. One of the interesting things that you hit on is I think we were very well, as an industry, we were very well prepared for this pandemic, and many of the practices that the rest of the world and the rest of the industries had to start following, we'd been doing that for years. Things like functional separation and properly donning PPE. And these are things that we all take for granted and have been doing in the healthcare laundry space for years before. So Tim, why don't you share your insights from an equipment and consulting perspective?
Yeah, I think what Owen said is very true. We had a level of preparation which was already there at the beginning. So whether it's RABC, the risk analysis, the contamination control of the process, we had already adopted that. What we did find was that there was a much larger rollout of healthcare standards in non-healthcare institutions. So a lot of the hospitality areas that had been earmarked as a quarantine center, they already had a standard which we could apply. So the transition from a hospitality laundry to a laundry which could process linen in a healthcare environment was quite quick. From a manufacturer or an equipment point of view, obviously we've had barrier machines and machines specifically for healthcare for a number of years, but the uptake globally in those machines has been astronomical. You're talking a 400% to 500% increase in a demand for the specific barrier machine. And together with that, a demand for machines which can process the PPE. So a tumble dryer, for example, that can process an N95 mask. It can be reused, it can be sanitized, it can be back into the field within 20 minutes. So those sort of growth areas have been apparent. And what we're seeing now is the spin-off into commercial laundries, even into laundromats, of healthcare sensitive equipment. So I think, yes, we were well positioned. It was a quick learning curve and we had to catch up in some areas, but in general, it's looking quite good for the future, I think. And I think in our region specifically, we were very quick to adapt. The customers were very quick to adapt. And, it plays a very important part in a country's overall management of the crisis. How effective is that healthcare laundry? And I think that overall we've done very well with it.
Excellent. Thank you, Tim. George, what can you give us your perspective?
Well, I think most of it has been said. I mean, as Eoin says, we are not yet post-pandemic, although we are at the stage that we have a more clear indication where we're going and what we have to deal with it, in terms of virus, minimizing the transferring of it, and as well by handling soiled linen from overwhelmed COVID-19 healthcare facilities. I mean, we're always at risk. If you remember a couple of months ago, almost a year ago, I mean, most of the hotels, they become like hubs in terms of COVID non-asymptomatic patients, which means they were handling exactly the same way as an healthcare facility in terms of washing, in terms of segregation, not segregation, because you use most of the soluble bags. But in terms of the process itself, we adopt exactly the same measures that you're doing in healthcare facilities to the hospitality side as well, because they were handling COVID patients, The future, we'll have to see exactly what's going to happen. I mean, we all discuss about the virus, but we see ups and downs in terms of countries like England, like Germany, like Italy, and even now France, that they came down and now they went up again. And of course, that puts an extra effort in healthcare facilities and of course, healthcare service providers, which means we'll have to take it very careful how we're going to address the future, to see how it's going to be.
Excellent. Thank you. How about you, Abdelrauf? What are you seeing out there?
Well, I agree with all my fellow esteemed panelists here. Like the healthcare laundry doesn't look any different from even before the pandemic. All these measures has been followed even before. And from chemical point of view, we already have not only Zydis, all the chemical manufacturer or chemical suppliers, they have their certified, registered disinfection procedures long time before the pandemic. So basically, the only thing that we notice, healthcare, not much changes, but commercial laundries, they start to try, or to say they started to try to adapt some of the practices that has been done in the healthcare to a certain level about disinfection, the hygiene, the personal hygiene of the employees, the social distancing during the work, in the work area. Like we've seen some good practices, especially on the flat work ironer, where they can put this a barrier or separator between the people who are feeding the flat work ironer. So we saw some changes on the commercial level. Healthcare, it's still functioning exactly the same from a chemical point of view.
Right on. So I'll give my perspective as a healthcare laundry processor. One thing I'll add is I have the honor of being the laundry that processed the hospital that had the first COVID cases in North America about a year and a month ago. So the honor is my isolation gowns were on the cover of the New York Times back in March of 2020. And it's kind of a funny thing there. So what I would actually concur with what's all been said so far. I think that one of the biggest things that we noticed is I've never seen a more dramatic change in what we're processing as during this. So for example, I think Eoin, you alluded to it earlier, there's been a huge, just a massive push to reusables that have happened. First, reusable isolation gowns, which you couldn't get, and then face masks, which you couldn't get at all. All these mom and pops started springing up making face masks, and these things all had to be laundered. So there's this huge not a new industry, but things that we've been processing for years, but never in these volumes, that just came up out of nowhere that were really challenging to get hold of. But conversely, some of the more traditional healthcare things that we did, such as surgical textiles, died out to almost nothing because, as you all, or at least in the United States, almost all elective surgeries went to zero, whereas everything in the hospital became COVID. So what a COVID patients and PPE need. They need, you know, the providers need isolation gowns and masks and scrubs and things like that. But yet the volume of surgical gowns and surgical towels went down to nothing. That's changed quite a bit now. But that was, boy, what a fascinating, instantaneous change that happened. The other thing I would add to that is there, as we're saying, we have done things. Healthcare laundry standards are very compatible with COVID standards. You know, there's hand hygiene is essential, and functional separation, and wearing PPE, and infection prevention, and surface decontamination, and all these things. So I do think that we were well positioned for these, but some of the workplace social distancing things were kind of new that we had to adapt to. But I think our industry probably had fewer adaptations than most industries out there, as has been mentioned. So that being said, let me segue into the next question. Given all these changes, what are some measures that have been taken to improve the productivity and efficiency in the laundry? And I think let's reverse the panel this time. So we'll start with you, Abdelrauf, this time.
Okay. The main work to improve productivity and efficiency is, we believe, is by improving the knowledge for the staff who are working, because it doesn't matter how much is the high level of automation that we have. If the people are not trained properly to operate it, then we will have some bottlenecks. So one of the challenges during the pandemic is the social distancing. So which means we have to reduce the amount of the labor for the same work in the same work area. So in the light of this, we have to improve on the training and the knowledge of the people on how to handle and how to be organized in the steps of the process. So these are the measures that have been done, because this was the challenge. By reducing the amount of the people in the same work area, you have to put more load on the same people to produce more.
Right on. Yeah, those excellent observations there. George?
Well, I mean, regarding changes, I think the most change that we did, because on healthcare, we are doing already through the infection control and through the JCIs, the auditors that we're doing almost twice a month from all the healthcare facilities. Okay, we haven't changed much the process inside the healthcare facility, you know. Of course, we changed some washing programs by increasing temperature and by adding disinfectant. And as well, we stopped recuperating the water from CVWs, okay, because we just threw it all completely away. But mainly, I think the biggest change that we did is in our process with hospitality. Hospitality, I say hospitality, is because we had in Abu Dhabi, about 70% of the hotels, they become COVID hubs for asymptomatic patients, you know, which means was a learning curve for hospitality, special housekeeping sector of it, you know, to try to accommodate and how to deal with these people going and sending staff to the laundry. How do they do it, you know? And then we had situations like, of course, we put in place the soluble bags. Everything was put in place in soluble bags, you know? But then we get the situation that people's got expensive clothes and they put the expensive clothes inside soluble bags. We don't do any segregation, and which means everything goes to washer extractor that washes at 75, 80 degrees C. And of course that we cannot have a Chanel dress or something like that after it's been processed at 75 or 80 degrees C in the same way that was before. And that was some of the challenges. And we have to really speak with some of these people and say, look, get a pair of shirts, get a shirt, and that's it. You know what I mean? Don't send anything expensive to the laundry because it's going to get damaged. You know?
Yeah, that's really funny. It's something we would never think about that, but it's reality that has been exposed to us. Tim, how about you?
I think one of the big things for efficiency, what we've seen is pre-planned maintenance. And you know what used to happen in a laundry was things would run and run and run until there's an issue. And if there's a breakdown, then a breakdown obviously has a serious knock-on effect. Because of access control and getting into the laundry, we've noticed that there's a lot more pre-planned maintenance. So once a month, the laundry will close down, a team will go in, they'll service machines, check programs, check water flows. And that has led to a lot more efficiency from customers. You know, there's much less downtime. The water usage is controlled, energy usage is controlled. And that spreads on to what Ablarof was saying about training. You know, you've got a team in the laundry that are now trained, and because they've been trained specifically on machines or programs, they can quickly identify when there's an issue, and they can bring it to the attention of the management so we can address the issue, whether it be programming, blocked valves, leaking, you know, and that all goes towards the efficiency. The other point is that there is much more track and trace facilities that are being used with machines. So the guys in the commercial laundries will know, but a mother bag will have a tag on it. The items inside that tag can all be traced. And so that when the process is complete, we can actually truly say that an article has been laundered at 85 degrees for 12 minutes with, you know, X percentage of chemical. And that's led to a lot less rewashes, and it's led to a lot quicker throughput. People know they have to abide by the standards. So what we're seeing is that, you know, by its very nature, it's actually made us become more efficient. A, with a pre-planned maintenance, and B, with the ability to track and trace and to prove that an item has actually been, you know, hygienically cleaned.
Excellent. Owen.
Well, I certainly can't improve on George's frontline experience in running healthcare laundries or yours, but I can say that when you've got a burning bridge, something big is happening, it's happening now. That's very difficult. A lot of hard work is required. You face some difficult challenges, but you can also make change happen really quickly. And that did happen. And in the previous question and discussion round, we talked about how that happened more for hospitality laundries than it did for healthcare laundries. So if you have a change that you have in mind, you can do it quick. That's a huge benefit, but it doesn't last because the sense of urgency dissipates over time. So I think there's one other thing that we can say about efficiency for businesses we're operating day after day is really important is you got to avoid making the irrelevant more efficient.
Oh yeah, that's
value, you know, more than just efficiency. Only efficiency won't keep your business alive, won't keep your customers happy. So if you're thinking technically in terms of business process efficiency, you're talking more lean and less Six Sigma, less statistics and more talking to your customers. And I think we did a lot of that last year. And I know you, Bubble, and I know you, Greg, did that. And others, hospital laundries that I work with did that. And now we got to keep doing that. That goes back to that first question. Post-pandemic laundry world, how do we figure that out? We talk to our customers, and sometimes we go past our customers and ignore them and do like the Henry Ford. He said, if I listened to my customers, I would have given them a faster horse. So you got to get deeper, deep field stuff. That's how we'll get more efficient and more valuable.
Right. That to your point, Owen, and everyone's point, we've noticed less of a focus on efficiency and more of a focus of getting in really tightly with our customers and, hey, what do you really need? How can we partner with you we know you're going through a really, really rough time here. What can we do to make sure that you're not in this mess with no PPE for your providers or no scrubs for your nurses or whatever. And yeah, there were many times when we threw efficiency out the window and we doubled and sometimes tripled up on turns just to make sure that they had enough things in the day to care for their patients. So I'm going to take a little bit of a digression here, and I'm going to ask, I'll throw out one of the questions from our chats, actually several of the questions. So the first one I'm going to start with is a great question. So recent studies say that traces of virus will stay for more than 24 hours. Is it not going to affect the processing time? And I'm going to start with that one. So interestingly, the virus, I'm sure that we've all read the different studies, but the virus lasts for different amounts of times on different surfaces. And I think copper and antimicrobial metals being the best, but it's still a couple of hours on that. In linens, I don't know if anyone's ever done a test on linens, but it's definitely will last more than 24 hours. And I've seen some out there that say it can last for up to a week on linens. The one thing I want to say, which is a really important thing, is coronaviruses are fortunately really easy to kill. So normal standard healthcare laundry processes will kill them, no problem. I think that the challenges that we have are not in the killing of it in the wash wheel. That's real easy. The challenges are protecting employees on the way into the wash wheel and then protecting the linen after it's been washed. So after it's out of the washer and into the dryer, and then it touches a lot of hands, or it touches conveyors, or it touches different surfaces here. The real challenge is protecting it from those contamination opportunities. And I think normal health, if we treat coronavirus the same way we would treat any other infectious disease out there, we'll be just fine. Coronavirus is no different than C. diff or actually it's less lethal than a lot of things that are out there, and it's less contagious than a lot of things out there. So we should be handling everything in healthcare laundry as if it is the most lethal organism that's out there. Does anyone have something to add to that?
Well, this is, one of my specialist subjects. I think the first thing you said is the most important. These coronaviruses are pretty easy to kill. Soap and water does it. Soap and water and a bit of heat does it. Soap and water and a bit of heat and time and mechanical action. If it's a competent wash process, it will get the job done. So that's really important that people understand that. The second thing is, luckily, epidemiologically speaking, how this spread, much less of it is spread by contact than the health authorities were saying a year ago. And what they were saying a year ago was, we don't know enough, be very, very cautious. We have to put all these controls in. And all these controls are right, but the ones that are most important are the ones that impact airborne, short-term, short distance. So
Great point. Yep.
Absolutely crucial. Keeping the 2 meters distance, absolutely crucial. Everything else is less crucial, but cumulatively makes a difference. So if we keep our surfaces clean, soap and water, broadly speaking, your special antiviral surface cleaning products can make a difference, but do they make enough difference to make up for their cost? I don't know. Good practices, simple practices, consistent practices, sticking to the rules is the hard part. The rules themselves are not difficult to think of.
Yeah, great point. Does anyone else have something to add to that?
I think most of it has been covered. As I say, linen is the easiest way to treat it. As long as you increase the temperature and add disinfectant, you kill the bacteria,
Yep.
Of course, then you have to, where it becomes more complicated and more dangerous is how you handle after it's been processed, after it's been washed.
Exactly. So one of the funny things out there is in any pivotal paradigm changing event, all these new products come to market, as we all know. Some of them are legitimate and some of them are someone trying to make a quick buck. And the one that I always laugh about, there's actually a lot that I laugh about with this one, is there's all these certified things that quote unquote kill coronavirus. So you need these things because they're certified to kill coronavirus. And I always ask myself, does that imply that what we've been doing all these years before does not kill coronaviruses? And I think that the message there is standard healthcare laundry practices, both in cleaning linen and cleaning surfaces and disinfecting, work just fine. We don't need new silver bullets or new whiz-bang technologies to do that. What we've been doing for many years will work just fine if we concentrate on executing them the way we're supposed to execute them.
Correct.
Another question, this is a good segue into what I just said. How would silver nanotechnology work for finished laundry leaving the facility to the end users? I have an answer on that, but I'm going to open it up to the field first.
Sorry,
the surgical textiles first, because the textiles we have to be very cautious about introducing active compounds. So I know that in most European and American markets, silver and copper is not used in surgical textiles. But when you get outside surgical textiles, then you get into hundreds of different use cases. And I think to be sensible, you got to talk about it in terms of the use cases where it really adds value and where it doesn't. But I'll let the next piece go to George, I think is looking to come in
there. George?
Sorry, can you rephrase the question again?
Oh, sure. I'm sorry. How would silver nanotechnology work for finished laundry leaving the facility to the end users?
Well, every time you get new things coming into the market, you know, in textiles, in equipment, and sometimes you have to go back a couple of years to see exactly what was the development in the laundries itself on it, you know, what we learned from the past, you know, and what we keep learning from the past, and see exactly what new technologies comes into the future. Can we really taking, is that going to be added value in terms of an end product and to the finishing side of it? I mean, I'll probably not be the right person to speak about that on it. You know, we buy textiles and we always try to get the most durable textiles as we can on it, you know, in order that they last longer, you know, at the right price as well. But at the end of the day, I'm probably not the right person to tell you about that.
Right. Okay. I have a little bit of experience with antimicrobial textiles, some with silver, some with copper, some other chemically. And are there compounds out there that are antimicrobial? Of course. And you know, are they better than normal laundry practice? Are they going to make your linen less infectious than normal laundry practices? I haven't seen that much data. I haven't seen that many studies that do that. The one thing I will say though is if you use those at home, your clothes will they won't smell as bad. So that's a nice thing because they are very effective at killing bacteria. So I can't say yes or no, use silver or copper or whatever antimicrobial based textiles out there. I can say that current processes without these seem to work just fine. And I have not seen a lot of evidence that we need things like that in addition to the current practices that we're using currently.
Yeah, and there are use cases in context of COVID where people are suggesting that masks treated with the right antimicrobial will be safer for the wearer. Nice idea, but I can't comment it. You'd need to be looking at the data yourself from trusted sources, and I just don't know that. I do know that in Scandinavia, just for instance, they don't want silver in anything. Now that's based on environmental concerns. So
sure.
Echo what George said, if we're buying products that last, that's our opportunity to differentiate ourselves from the single.
Right.
Use provider.
Oh, and I think you cut out for a second for me anyway.
Please.
So if you could repeat what you just said.
Hear what you said.
Okay, I think is panelists, are you able to hear me? I don't want to see if I'm the one cutting out or if it's Owen that's cutting out.
I think it's Owen.
Okay. So I apologize, Owen. I'm going to come back to you in a little bit, but I think something might have happened with your session. So I'll go to the next formal or the next question that we have here. The pandemic resulted in a lot of challenges with regards to ensuring the safety of not only the linens, but also the safety of one's staff. What are the measures taken to ensure teams and their families' safety and those visiting the plant? And let's start this one with, let's start with Abdelrauf for this one.
Okay, so basically what we have seen, the practices is they started by monitoring the temperature and for the visitors, of course, and for the workers, they implemented more instructions about the hygiene. How do you do the proper hand wash? How do you do the proper disinfection using this hand gel or any kind of sanitizers or disinfectant. And basically the monitoring for the workers, like to have at least twice a month the PCR test to make sure that the people did not catch the virus. So all of this information and training and monitoring this, and of course the social distancing. So all the instruction basically following the rules from the WHO, and here in UAE we follow the rules that was implemented by the government. And some facilities took it for an extra. And everywhere you have you visit any facility, any plant you visit now, you can see a lot of disinfection stations where you can get the hand gel and sanitize your hand while on the go. So this is what we have noticed and what has been implemented to keep the people safe.
Excellent. George, how about you?
Well, it's a good point and a good question, actually. You know what I mean? Let me tell you something. I mean, I think this is a day that I'll never forget for the rest of the days of my life, and that is the 24th of April, 2020. Okay, Bubble has got a working force of about 500 people, laundry affected. Okay, on the 24th of April, we tested 80% of our workforce. I mean, from admin to people in the laundry itself. And then we found out that 75% of these people were infected. I mean, most of the people that were in camps, okay? Which means from one day to the other, from a workforce of 300 people, we came down to 60 people, okay? And then you got, of course, you got the hospitals, you know, screaming for leave, okay? And we had to do in a space of 2-3 days. That's why I say it's a day that I'll never forget for the rest of the days of my life on it, you know. You had to put people from admin, you know, from finance, you know, from helpers, and we got another company, which is a facilities management company. I mean, from the 60 people, we managed to increase to about 180 people, okay? But was everybody hands-on, including myself. I mean, I was putting towels on the towel holder, you know what I mean? Which means these are the challenges that in a situation like that, you have to be elastic in order that you can try to correspond and to respond to whatever challenges you come across in it. You know? Of course, then we implemented all the things, you know, like the sanitizer stations, you know, temperature, everybody that was coming onto the laundry was monitoring in terms of temperature. I mean, hygiene as well. I mean, we are working with a lot of communities and a lot of people from different countries, you know, and they were very scared at one stage, you know, because you get news that people are dying, people are falling, and you have to go through a period that you have to educate these people and challenge them and explain to them, you know, like your family, you know, saying, look, this can happen to anybody, you know, and that is one of the most challenging times that I had in the laundry business or in any business that I've been involved was in this period of time. And we did a lot of forums with these people, you know, half an hour forums explaining exactly, because people, some of them, they refused to come to work because they were scared, you know. I mean, we're handling COVID contaminated linen, you know, I'm going to get it, I'm going to die, you know, and these are the things you go through on it. You know, I think from a perspective of a person that has been involved into the business, I mean, was a challenge, was very difficult, you know, but was very enrichment.
Wow, that's quite a story. So just to add to that, did the people become contaminated at home or at work,
yeah, I mean, because,
probably you don't know?
I mean, look, most of the workforce that we got, it stays in the camps. You know, of course, the camps are very good and very, very taken care of it in terms of, especially in this period of time. But accommodation is about 5-6 people for one room. You know, one gets infected, the other 6 will get infected, or the other 5 will get infected straight away. You know, that's a 90% probability. You know, as we got about 300 people that are in accommodation camps on it, you know, of course the percentage is so high.
Sure.
But we tested everybody. I mean, we were probably one of the few laundries in this part of the world that we tested every. It cost us quite a few couple of dollars on it, you know, as you can imagine, you know. But at the end of the day, at least we had some peace of mind that who had it and who would not have it, you know what I mean?
Yeah. I'll add as a fellow laundry person, I'll add my experience. You just described the nightmare scenario that I thank heavens did not happen to us. But that was what you just described is what I was absolutely fearful of for every day, and I'm still very fearful of that. It's just an outbreak going through the laundry and then not having workers when your demand and your volume is up through the roof. One of the biggest challenges that we had, which you also hit on, is just the fear of our employees, and people don't want to come to work, and I'm going to get sick and I'm going to die, and I'm seeing all these horrible things on the news, and I'm just inundated with these messages of stay away, stay away. So what we had to really do was sit down with, or not sit down, but really educate our people in what this means and how, our message was everything that you've been doing since you've been working at this place is protecting you from COVID and other things. So do exactly what we've been training you to do, and everything will be just fine. This is something that is spread, based on the data, airborne. So wear face masks and wear PPE, and everything will be fine. The bigger change for us was around our sick policy. So we really had to be more rigorous on if someone has a fever, you take someone's temperature, or even if people in the person's home were sick or tested with COVID, then we quarantined those people for 14 days before we would let them back to work. Fortunately, we didn't have the doomsday scenario, but we definitely know several people that did it. And wow, George, I really take my hat off to you. And that sounds just a horrible thing, but very heroic by the same token of lots of people. And it's no fun running laundries with office people trying to feed sheets. I've been there, and they do a terrible job, but they might be good admin people. Anything else to add on that, anyone?
I think
Greg,
it's the be all and end all.
Okay, what was that? I can't remember who. Owen, what was that?
I think George's story is the be all and end all of that piece. That really that sums it up.
Yeah, definitely. Okay, I will go to the next question from our from the field, and that is, contamination is more in healthcare laundry. So is the usage of manpower and chemicals, but the hospitals are not ready to pay the service provider the good rates. There is a dearth of healthcare laundry professionals in India, as not much people wish to join it as a career opportunity. Okay, Owen, let's start with you on that one.
Okay, well, I'm no expert on India. So that's really important, that everywhere you are is a little bit different, and individual cities in India would be quite different from each other.
But are you an expert in customers not wanting to pay higher rates?
Oh, yeah. Yeah, absolutely. And that's actually in my personal story now, the story that George told us today. I mean, that's it for the day. I'm going to remember that for the rest of my life. But in my little personal story, why did I want to treat innovation as a specialist subject area? It's for exactly that reason. So if you're in a world where you're doing the same thing as the other people, you can only charge what the other people are charging. And if you're in a contract with your customer where they've got total control, you're only going to get paid what they say they're going to pay you. And that's why you have to have, as you, Greg, and George described earlier, you have to grab a hold of those customer relationships and really dive in and find out what they value. And that's how you can get out of the commoditized parts. You won't bin the commoditized parts world. You can't change the laundry game into a business that has no commodities. But if you work in a business or a unit that has an opportunity to learn from its customers, work with its customers, you can find the niches, the service, the particular local requirements that people need, value, and will pay for. Sounds easy, and it's not.
Right. Tim.
Yeah, look, I think, in terms of the pandemic, we've been dealing with, particularly in Africa, Ebola. which, as we know, is a lot more deadly. We've got the HIV pandemic throughout Africa. So we've been having the technical knowledge, the laundries, and the skills to run that process. To roll it over to COVID has not been a dramatic change. What we have seen it do is we've seen it accelerate that movement to a true healthcare barrier laundry. And the question in particular regarding India, the change in India in the last 2 years, laundries in healthcare institutions, rather than just a standard laundry, has been huge. There is currently, I think there's over 120 hospitals out on tender for barrier institutions to be put in. Each one of those does require a higher level of management, a higher level of training for staff, and obviously there is a higher cost attached to it. The point is that the government and the private institutions are prepared now to at least pay some of that cost. So there is an adoption of it. It may not be the adoption that we want it to be, and it may not be the premium that we want to charge, but there is a recognition that yes, you can actually offer a premium service healthcare-wise, and you can charge accordingly for it. So there is a change. Whether it's propagated throughout the region, I don't know, but certainly in India, yes, it is.
Good news.
Yeah, great. Abdul Rauf.
And we've seen the same, Ethiopia, Zambia, Mauritius, so many different countries are moving to the French model where, any healthcare institution should ideally be based upon a barrier principle. And we're seeing that roll out. So I think that the change is happening.
Great.
So, if I may add, so this is one of our biggest challenges. People or the customers, they want 5-star quality, but they are only willing to pay for 2 stars quality. And this causes a lot of problems because, especially in the healthcare, let's talk about what is the cost of a linen disinfection wash formula. It's almost triple when it comes for the cost. If you are talking about thermochemical disinfection, it costs almost the triple from the normal linen wash formula. Double to triple, depends on the country, depends on the conditions. And if you are talking about only thermal, so the laundry has to invest more in the energy to heat it up to 85 degrees Celsius or 90 degrees Celsius to give it 10 minutes or 15 minutes. So this is an extra cost that the customer at the end user doesn't want to acknowledge. So this was one of the challenges, and this created a lot of issues because laundries who are not supposed to be in the healthcare or not very well equipped, they found an opportunity to enter this field and offer no disinfection whatsoever. Only like they are using chlorine or they are using 70 degrees Celsius for not enough contact time. And 70 degrees Celsius doesn't do anything. You need everything is above 70 degrees Celsius by the CDC, the international CDC instructions. You need above 70 degrees Celsius or 71 with minimum 25 minutes. So this pressure from the end user created another problem and competitor for the people who are trying to provide a good quality service. So this is the only thing I can add. It is always a challenge to educate the end user that when you are asking for disinfection, it has a cost, it has a process that has to be followed. Not everybody who can call themselves a healthcare laundry can be a real healthcare laundry.
Yeah, I think that's right on. You hit the key word there, and that's education. I think as an industry, the more we can become strategic advisors and partners to our healthcare customers and less suppliers of commodity products, the more successful we'll be. I found that, if a conversation with your customer starts with price, you're probably talking to the wrong person at that hospital, because I guarantee you there are infection prevention people or people in the C-suite who, in the grand scheme of things, in the healthcare world, at least in the United States, the cost of healthcare laundry is a drop in the bucket. It's really insignificant when you look at the cost of healthcare acquired infections or the costs to a hospital in sickness or infections or even image of having non-professionally or non-cleaned according to standards laundry. And it's critical for us to get that story out of what that means to them, but also this process that we go through and all these standards that we follow, that there's a cost to that, and it's well worth the cost. So you really want to pay that, or you're going to get in some trouble.
If I could just add, Tim has alluded to this and Greg has alluded to this. So if you've got education, if you've got the relationships with your customers, then you absolutely need some sense, qualification, certification. George mentioned JCI earlier. You've got the HLAC scheme in the US and others, or RABC that Tim mentioned earlier, which is the European equivalent. So that's where they come into play. Not everybody likes standards, but if you have a good standard, you can have fair competition on a level playing field, and you've got a barrier to entry for those who are not competent or not ready to be in that market.
Right on.
Well, yeah, I mean, if I can just add something on it, we are facing both sides of the equation. We got hospitality in one side, and then we got healthcare on one side. Our facility in healthcare was finished in end of 2015. And we are almost at full capacity at this stage on it, Of course, I mean, the owner invested a lot of millions in this facility. We can say it's probably, I think it is, probably the best healthcare facility in the Middle East, the one that I'm working with it. And we working with pressure and positive, with positive and negative pressures on it on both sides of it, And of course, when we ask the clients to come and see it, and they come and see the laundry, they see a difference. Speaking with the healthcare sector is different than speaking with the hospitality sector because of the infection control, because of the auditors that the hospitals get. And we invest as well, not just in machine, but in people as well. I mean, we got a person from the infection control side of it that knows it, that works with us, he's an employee of Bubbles, that knows exactly what are the requirements of the hospitals, And by investing in people, not just in machines, I think you get out of it, most out of it, of the clients, in order that you can charge another 20 fils or 20 cents per kilo of a piece on it, because they know what they're going to get in terms of end product.
Yeah, excellent, George. That's very, very good point. Don't talk to the financial people in the hospitals. I think that's a good lesson too. Yeah. Talk to the infection people and the C-suite people. Okay, next question. I think we've touched on this, but I'll ask it in a different way. What is the healthcare customer asking for during the pandemic? What kind of support are you giving your clients to maintain a continued relationship? How have you changed or adapted to suit their needs? Tim, let's start with you.
Yeah, difficult from a service provider perspective. From a machinery side, capacity has increased drastically. We're making 3 times more machines, healthcare machines, than what we used to. In terms of what the customers are asking from a delivery perspective from a machine, it's the track and trace. Track and trace used to be optional in a machine. It's now compulsory. So every customer is asking for the ability to prove that an article has gone through the process, and to produce a document that will show that they can deliver to their end customer. Whether that be a hospital, whether it be a clinic, they can show this batch has gone through X process. Those are the 2 main things. So the increase in production, I think at the moment, our Czech production line, very similar to what George had in Czechoslovakia. We had a bit of an issue. We had the admin staff on the production line. 300% to 400% increase in those machines. And we are still delivering machines within 3 weeks of order. We had a peak during the field hospital stage, where we would literally produce machines within 3 days and get them shipped around the world. So that was quite a demand. And then subsequent to that, the track and trace. Those are the 2 main things that we've seen.
Excellent. I'll add to the track and trace. That's a good one. We're seeing that as well, not only in the equipment, but in the process perspective. So we're asking for lots of proof and validation from our healthcare customers that not only are our wash processes being done correctly and our equipment is calibrated correctly, but also our facility management and our environmental hygiene practices. So actually show me the checklist where you cleaned that cart, show me the chemical dilution rates of your disinfectant for cart cleaning and for tables. People didn't used to ask for those things, but now they're asking for them because they know the importance of that. And that's a good sign. That shows that your healthcare customers are educated in what has to happen for them to receive hygienically clean linen.
Well, if I can add on it into it, I mean, like every month we send reports to the biggest hospitals, and not just the auditing when they come unannounced and they can walk into the laundry and check everything on it, which means we have to have the processes in top shape. But when we do the reports to specific groups of hospital, we tell them exactly how many pieces they did during that month, how it was the process in terms of chemical processes or washing programs, what was the washing program adopted. And you go through, I mean, I can tell you that some reports, for a case for one of the biggest private hospitals in Abu Dhabi, it's probably about 30 pages or something like that, which means they get value for what they get as well. Because when they get audited, they can just take these documents and say, that's where this is processed, and this is a continuous learning curve for us, service providers, and for the hospitals as well. I can tell you one thing, that at the beginning of the pandemic, we did all the SOPs for the hospitals, how we're going to pick up the laundry at the facilities, and they're going to bring it to the laundry. Everything was documented. And then we had a question from one of the facilities that they were going to incinerate the linen. And I says, no, come on, don't do that. Otherwise, no linen is going to be available in the market in the next few weeks on it, And these are the things that you have to deal with it, I mean, you can incinerate your linen. Don't incinerate my linen, because it's going to be washed and properly washed on it, But these are the things that you're going through, and that it's all a learning curve, or was a learning curve for a lot of us, And all these situations, was good to talk now, but at that time wasn't that easy.
Interesting. Incinerate the linen. That was during Ebola. That was the recommendation from, actually even the CDC recommended that, which was kind of interesting. But yeah, not with COVID. We didn't get to that one.
No.
Okay, we have about 2 minutes left here. So the final question is, what is the way forward? How do we ensure better business continuity in the healthcare laundry sector? It's kind of a general question. And I guess I will say, I will open it up to closing statements from people that can address what's the way forward in this new crazy world that we live in.
I mean, for me,
start just by talking about the laundry process, just the wash process. It's a hurdle technology. The better we know our own processes, the better we can validate our own process. The more data we have, the less we'll be beholden to other people. So I can, and others can, validate the performance of a process at 30 degrees or with no chlorine or whatever, if you know your process well enough. I'll add one other piece. When I think it was Electrolux asked a couple of futurists to look at this question, they spoke to a lady called Cecilia Hertz. She's a Swedish space and defense consultant. And they said, look forward 100 years, what do you see? And she said, laundry is a bag full of bugs. You give the person a plastic bag, it's pre-inoculated with a particular set of organisms, and 24 hours later, the goods are clean. No water, no plant, no nothing.
Well, I'll be out of a job, but it'll be 400 years, so it won't matter anyway.
All right. Yeah. I mean, if I can reply to your answer, I think, as I say, and I think I mentioned this before, you can have the best facility in the world, best equipment, and it's a Italian thing. I mean, we see some equipment at the moment that is very, very, very good. in terms of output and in terms of performance and in terms of minimize of labor costs. But at the end of the day, we're following the path of investing in your people. And if you invest in people, you're going to get the outcome of it. And of course, you're going to serve your clients better.
Yeah, I think that's right on. Investing in your people is just so important in this industry and hard to do, but you're going to serve your clients the best that way. So we are actually out of time right now. So I would like to thank you so much. I certainly learned a lot, Matt, and virtual people out there, hopefully you've all learned a lot. Thank you to all the panelists for sharing your expertise and your stories. I thought this was a great session.
Thank you.
Thank you.
Thank you.
Thank you, Greg. Thank you, everybody.
Thank you.
Thank you, everybody.